Hi, I'm Dr. Eyal Lederman. I'm an osteopath, a doctorate in physiotherapy, honorary senior lecturer at University College London, and director of CPDO, a center providing professional development courses for physical therapists. Functional neuromuscular rehabilitation is a science-based approach that I have developed during my physiotherapy doctorate research. In this research project, I've examined the effect of manual therapy on motor control and movement rehabilitation. In this video, I will demonstrate the principles of this approach using a case presentation. In this slide, we see the shoulder of a 75-year-old patient who is a keen tennis player. He presented with a combination of injuries, including a full tear of the glenohumeral capsule, humeral head superior displacement, full tear of the supraspinatus tendon and the long head of the biceps, as well as effusion in the glenohumeral joint space. I saw the patient 2 weeks after his injury. At the time, he was severely restricted in using his arm during daily and recreational activities. He elected not to have surgery, and his recovery was managed using functional neuromuscular rehabilitation principles. Here's a clip of the patient playing tennis for the first time 6 weeks after commencing his rehabilitation. The serving arm is the affected side. We can see that within a short period of 6 weeks, he has recovered his functional capacity to play tennis. He was pain-free at that point and estimated that he was playing at 85% of his full tennis capacity. 4 years later, he's still playing tennis regularly. His rapid recovery was achieved by applying basic principles of motor control during the rehabilitation. There are several principles in functional neuromuscular rehabilitation which differentiate it from other traditional and current rehabilitation and training methods. Rehabilitation of motor control has to be whole and goal, not fragmented. Rehabilitation has to be task-specific and functional, resembling daily activities. And rehabilitation is directed at the components of motor control. An important principle in motor control and rehabilitation is that the training has to be of the whole task and contain a clear goal. When we observe a person perform a movement, we can identify two components: the movement used to achieve the goal and the goal itself. Rehabilitation and motor learning is optimized when the movement and the goal are integrated. Another important motor learning and rehabilitation principle is that the training has to resemble as close as possible the activity that a person aims to recover. This is called training specificity. So if you train for yoga, there will be a whole person and motor control adaptation specific for that activity. And similarly for resistance training or running. When we train in a particular task, there is a specialized multi-system adaptation to support that specific activity. Training in other activities will always be second best or even ineffective. The focus in functional neuromuscular rehabilitation is in helping the patient recover the functional capacity by targeting specific motor control components that underlie their condition. Every action we take contains several control components such as regulation of force, velocity, recruitment timing of synergists, coordination, and so on. When a person has an injury, is in pain, or even has fear of movement, these control components tend to change and affect their activities. In functional rehabilitation, we aim to identify the task components that are negatively influencing the patient's functional repertoire. The management then challenges the affected control components within the task itself. In this comprehensive workshop, you will become an expert in neuromuscular rehabilitation, expanding your scope of practice and making it more effective. Topics included in this workshop are motor control and motor learning principles, role of proprioception in movement, training principles for sports and movement performance, the motor system in injury, pain, and central nervous system damage, rehabilitation of movement control after joint and muscle injuries, rehabilitation of movement control post-surgery, neuromuscular rehabilitation for patients with central nervous system damage, motor rehabilitation in the presence of pain, psychological factors and motor control, cognitions and behavior in managing movement recovery, self-care strategies for patients, exercise prescription, and injury prevention. Hope you found this introduction useful. For more information, visit our website cpdo.net.